Hi, I'm Emily van der Venter, Associate Director of Public Health from Warwickshire County Council. I'm with my colleague Johnathan Toy. Today we're just going to take you through some information around the pattern of cases we're seeing within Warwickshire, and some tips around the new regulations and restrictions in place at the moment, and then tips around helping you to stay mentally well during this difficult time. Johnathan, do you want to say hi?
Yes, hi everybody. Great for you to join us. Hope you find this blog helpful. Emily and I have been working together on some of the issues around outbreaks, issues in terms of regulations, or really since the end of March. And Emily's been one of those amazing people on public health who fill in our limited knowledge in terms of what we should be looking at. But we built up a really good understanding between us on the kind of things. So we hope what we share with you today across the community voluntary sector gives you the ability then to share some of that knowledge wider through your networks, and that will be really helpful for both of us. Absolutely. Emily, you've got some slides to share, haven't you? I think so. Well, shall we talk through them?
Yeah, thanks, Johnathan. So I'll share my screen now. Hopefully that's come up for you. So just to go firstly to the pattern of cases that we're seeing within Warwickshire. So this shows the number of coronavirus cases since the beginning of March. The blue are tests that have been taken with health and care settings, so tests and positive results from those settings. And you can see the pink line starting from kind of mid-April. Those are tests and positive results taken within community settings. So that's when mass testing started in the beginning of April. So the two peaks aren't directly comparable. But you can see if you look at the blue lines, we've had a slower increase in terms of cases within the health and care settings, but certainly seeing that increase now. And we've seen a really quite rapid and significant increase in cases in the community since the beginning of September, really. Just to break that down by district and borough here, so we've got a pink line for North Warwickshire, purple for Nuneaton and Bedworth, green for Rugby, black for Stratford, yellow for Warwick, and then the blue is the Warwickshire overall. So you can see at the moment we're seeing really high rates within North Warwickshire, and that's increased fairly rapidly. This shows the last 3 weeks. Warwick has been high, and primarily that's been associated with younger people, cases being seen within the student population, but we are now seeing a wider spread into other age groups. So I'll take us on to what we call our heat map. This shows weeks across the top from the beginning of March, so week commencing 2nd of March up to the week commencing the 26th of October, and then 10-year age bands down the side. And what you're looking for really is moving from yellow to orange to red when we have the highest number of cases. So you can see beginning of the wave, we didn't see much in the younger age groups, but that's primarily because we weren't doing that mass community testing. We've seen that increase in younger age groups really, as I say, since the beginning of September, and over the last three weeks or so, seeing that spread into older age groups. The latest data, there's probably a bit of catching up in terms of getting test results through that may show some more spread into older age groups. But hopefully you get a sense of what that picture is showing you. I'm going to pass over to Johnathan to touch on some of the district and borough rates more specifically.
Thanks, Emily. I think really important, just to kind of go back to what Emily was saying on that graph, you can see how the rates change a lot, and I think, Emily, you'd agree, wouldn't you, that if you look at some of the early periods in the autumn and places like Rugby, which are a bit higher than other areas, we've seen quite a shift, haven't we, in terms of what those different areas, and hopefully between the two of us we can give you a bit of an insight of what that shift looks like and that what's been behind it. These are those heat maps Emily was just talking about in terms of North Warwickshire and Nuneaton. And the reason we wanted to show these to you for each of the different districts and boroughs was just to show you that bit of variance that we find within those different areas. So you can see within North Warwickshire, going back to early September, we had fairly low level rates coming, and then as we went into October, what we started to see was an escalation, not just in the younger age range, but much more into the kind of that working adult, and that goes along lines, doesn't it, Emily, with some of the workplace based issues we've been facing, that challenge between what's happening within the home and what's happening within the workplace. So there's definitely a connection, and Emily and I will talk that through a bit later. Nuneaton, again, a bit of a spread that took place in early September within that younger age range, and then again moving back into that working population. And Emily's going to share with you in a little bit some of the slides in terms of issues around ethnicity, but also deprivation as well, which puts some context, particularly for Nuneaton. So have a look at the ones for rugby. I think is the next one, isn't it, Emily? Yeah, thanks. Okay. So the rugby one's again really interesting for us. We saw quite a lot of activity in early September, mid-September. Seemed to be linked very much to sixth form age range. People just going to university had a lot of activity within rugby in terms of nighttime economy connected to that particular age range, and a lot of really good work was done in rugby in terms of managing that, both with public health colleagues, our brilliant colleagues at the district and borough level within rugby, the rugby wardens, etc. And interestingly, with that early work that went on, rugby's not necessarily seen the same level of rate rise that we've seen elsewhere. But the worrying factor for us is when you start looking to the latter part of October, how that's moved into the older age range. And that's always been one of our biggest concerns, Emily, hasn't it?
Absolutely.
Yeah.
It's been quite encouraging, I'd say, to see the rates in rugby kind of levelling off after that steep increase that we did see. So it shows, we can get a grip on this. But as you say, definitely seeing that spread into older age groups, which leads to more concern. Yeah,
there was some great work put in by rugby that actually fairly swiftly to try and get a grip of that. So it does show when we apply the right kind of interventions, we can make a difference locally. Stratford and Warwick, again, really interesting, very different in terms of the issues and challenges. And I know Emily's going to talk a bit more about Stratford in a few minutes' time. Same issues in terms of that younger age range, same connection with people pre moving into university, that sixth form age range, and then as the universities start to come back. And we've seen a few issues connected to the workplace in Stratford. And then moving into the older population. But for Warwick, on the whole, that focus has very much been in the 18 to 24-year-old age grade. So when Emily and I analyse those two younger categories, 10 to 19, 20 to 29, the predominant number fall in that age range of 18 to 24, that student age population, and not necessarily seen the same spread into the older age range that we've seen elsewhere. But it's the thing we want to monitor most. What we don't want to see is that escalating beyond the beyond that group.
Sadly, Jonathan, I think I should just add there, this week we have started to see higher rates in older 60s in Warwick. So Stratford has got an older population, so we have seen higher rates and numbers within the older population in Stratford, but we're now starting to see that within Warwick as well, which is concerning. So yeah, as you say, was primarily in the student population, and that's still where we're seeing the highest number of cases, but we are seeing that spread both within workplace settings, in the household, and then into some older age groups as well, impacting on hospital admissions too. So unfortunately, we are seeing that. So just a comment, I suppose, that whatever age group you fall into, actually need to be really vigilant and careful at this time around reducing social contacts and potential exposures. So we'll move on just to show you our analysis by deprivation level. So for each of our districts and boroughs here, we've got the breakdown of cases and what percentage of the deprived population they sit within. So the easiest really is to look at the pink. So that's the 50% least deprived or most affluent population. And then this is the second graph, is what the whole population looks like in terms of that spread around affluent and deprived areas. So actually, a little bit against the national trend or what might be expected, we are seeing more cases in more affluent areas, particularly within North Warwickshire, Nuneaton and Rugby. You can see the pink bar in terms of cases is slightly larger than it is in terms of the overall population split. Now that's a little bit different in Stratford and Warwick, where actually we are seeing an overrepresentation of people from less affluent areas in both of those geographies. Warwickshire overall, then it kind of averages out a little bit, but I think again it's that word of caution in terms of whatever socio-economic bracket you live in, the risk remains for all of us. And then ethnicity. So this, again, similar to the deprivation breakdown, the first chart for each district, or the first bar for each district and borough, is the proportion of cases which fall into each ethnic group. And then that's compared to the latest data we have on ethnicity, or the most robust data from the census, which is a little bit old now in terms of being 2011. So that's a little word of caution on interpreting the data. The other word of caution is actually in terms of coronavirus cases. We know about 20% of those cases haven't disclosed their ethnic origin. So we do have some gaps in the data there. But what it seems to be showing is that we are seeing that overrepresentation of people from Black and minority ethnic groups across each of our districts and boroughs. So within North Warwickshire, more specifically, we seem to be seeing an overrepresentation of people from Asian or Asian British backgrounds. The purple bar there you can see is bigger than the same colour bar from the census, and then those falling into the other category as well, which is kind of a broader one. Similarly, within Nuneaton and Bedworth, Asian British being overrepresented, as are white other, the orange bar there, and other ethnic groups. Rugby, white other seems to be the main category that's overrepresented there. Within Stratford on Avon, we're also seeing white other being significantly overrepresented, and some overrepresentation amongst Asian and Asian British cases in terms of coronavirus cases. And in Warwick, you can see actually quite a big difference there between the number of, or the proportion of coronavirus cases from Asian or Asian British backgrounds compared to the general population figure within Warwick. So yeah, you know, that is a pattern that's been seen nationally, particularly within seeing higher rates of cases in Asian and people from Black backgrounds. So please be extra careful around contacts if you're within those groups. And then Warwickshire wide, I think kind of see that picture culminating really across the county as a whole, with particularly the Asian British and the white other groups being overrepresented. And then we've had a look at our data on close contacts. So this looks at where close contacts have been identified. Actually, where was the source of their potential exposure? So that's not to say they've become a case, but they are at risk of becoming a case, and you know, should be self-isolating following contact with the case. So you can see that the grouping of exposure settings at the bottom of the chart, very much around household settings. So household members, that's not surprising. You know, if you're a case, your household members will be close contacts, and you need to be really careful if you've got someone with coronavirus in the household. There are ways you can reduce your risk of being infected yourself. So using separate bathrooms if you can, certainly using separate towels, trying to avoid using the same space as each other whilst the individual is symptomatic, making sure you clean down common areas, so clean down the kitchen after the case has been in, and just being extra vigilant there. Things like opening the windows so you can improve ventilation within the house can also help reduce your risk, and potentially wearing face coverings if you are sharing the same space as the individual that's infected at the time. But then after that, we see a bit of a mixture in terms of settings where people are exposed, quite a pattern really around hospitality settings, some workplaces, and wider settings. But Johnathan, I don't know if you wanted to chip in on some of that information.
Thanks, Emily. I mean, I think I'd go back to some of the cases we've looked at. Really, that feature and that link between household and household transmission in the workplace is really important. So there are, among other common features that we're seeing, for example, if people are car sharing on their way on their journey to work, we're seeing that as a constant feature in terms of the type of spread. We're often finding situations where people from the same family or the same household are working in the same premises, and that in itself creates additional spread within that environment. So we're kind of putting that bit of challenge out, particularly to businesses, about how are you managing that interrelationship between the home and the workplace. What could you do to make sure that if people are living in a shared accommodation or in the same household, how could they organise their workforce so that actually that is contained and doesn't necessarily spread across different shift patterns or different working environments. as well as tightening up on some of the shared facilities within those working environments as well. So they're constant conversations that we're having. Let's also be clear that some of the connections we're having within households and household transmission, we've heard the word super spreader before, but it only takes somebody who has had who is COVID positive to want to do the best thing in terms of their business or their community or their friends, and going around trying to provide services. We're actually finding that then actually increases transmission. We've actually had areas of our county where somebody providing a service in someone's home has actually had the sad impact of affecting tens of people within that local area. So this is the reason why people had to be so vigilant. And it's not a matter about challenging what the regulation's saying. It's doing the right thing for your community, the right thing for your family, and the right thing for your colleagues. And they're the messages we need to get out.
Absolutely. Thanks, Johnathan. And some of those other common themes we're seeing in workplaces, which I think are relevant to kind of thinking about the household setting as well, is that sharing of enclosed spaces for a prolonged period of time, and looking at, as you say, the kind of shared equipment, shared areas, and just making sure you're really vigilant around cleaning those frequently touched what we call touch points, such as door handles, kettles, shared cutlery, that type of thing. So I think, we've picked that up in the workplace, but again, learning for household settings and community settings as well. Okay, shall I head over now to the next slide, which is just a summary really of the recent restrictions that obviously came into play yesterday. Do you want to go through the main ones there, Johnathan?
I think the essence of the main restrictions is do what you can to minimise the wider contact outside of either your own household or within one other person. It's really important that you do that. That's the gist of what the legislation is trying to say. There's a list of premises that should remain closed, and that's within the guidance. And there are some exemptions in relation to that, and those exemptions relate to things like things you have to do. If you cannot work from home and you have to do your work from a different environment, that's part of the exemption. But the first question has to be, how could you do that work from home and minimise that? There are certain elements in terms of education and training that you can go and do in a different setting. But again, my question would always be, why couldn't you do it virtually? Is there a way you could do it through a different medium that doesn't mean you have to go and go into a venue, which actually then probably increases your exposure or increases your contact? They're the things that really the legislation is trying to say to people, and it is very much about protecting people who are most vulnerable. We have to understand that the evidence and the data that we are seeing, and the things that Emily and we are showing you today, demonstrates that there are people within our community who are more vulnerable. And it's not necessarily divided by whether you fall in some kind of a deprivation category, but it is very much a combination of your background, your gender. We see some gender variations, and your age variations, and ethnicity. So it's that combination of things that actually puts people at risk. And please note the legislation has brought the age range down to over 60s. So that's something very much to bear in mind, which is different to the last legislation. Does that help, Emily?
Yeah, that's really helpful. Thanks, Jonathan. That's really sensible advice there. And as you say, really important to note that clinically vulnerable was previously 70, or is still 70 and over, or an underlying health condition, but they're now advising over 60s to really take extra care when you're out and about, and to really minimise social contacts as much as possible. So I've added a link to this slide here for the latest guidance, which gives the full categories in terms of who's considered clinically vulnerable or clinically extremely vulnerable. So that latter group has had a new addition of people with Down syndrome, and then the existing categories remain, so primarily around people who are either have a health condition or are on treatment that impacts their immune system, so what we'd call potentially immunosuppressed or immunocompromised, and then if you're pregnant and with a heart condition as well. I would say there are health conditions that we know present an increased risk of people developing severe illness. And some of those health conditions we can do things about in terms of reducing the risk of developing them. So hypertension, diabetes, and then being obese or overweight are all present more risk of being severely ill. So, you know, actions like increasing physical activity, ensuring a healthy weight, and also smokers are at increased risk both of contracting coronavirus and of developing serious illness. And obviously you can do, it's not easy, but you can try to quit smoking to try and reduce your risk there. So please do think about, I know it's hard when we're stuck at home, but think about how you can maximise your physical activity and keep a healthy diet during this time to help reduce risk of serious illness and actually to help your chances of a good and swift recovery if you were unfortunate to contract coronavirus. So I've put on the bottom there that actually if you are in that clinically extremely vulnerable list, the guidance is you must not go to work. So if you cannot work from home, then you should be entitled to furlough or sick pay. So you need to discuss the arrangements with your employer there. It's obviously a worrying time for people in that category. So we have got a free phone number set up for, with Warwickshire County Council that you can call to get advice on any difficulties you're facing. We can link you to appropriate support, be that through our volunteer network to help you access shopping or help you get an online delivery slot with the major supermarkets. But also there's extra support around, be that linking you to people who would be willing to walk your dog, for example, linking you into mental health and wellbeing support. And Warwickshire Carver have set up a befriending line. So if you are either self-isolating due to symptoms or, you know, limiting your social contacts and going out because you're extremely clinically vulnerable, then there's weekly phone calls that can be made with you just to help combat feelings of loneliness and any concerns around anxiety that you have at this time. So a bit more information on our phone line there. So it is open 7 days a week, but slightly different opening hours for each day and over the weekend, but there is somebody there to help you. There's also a link I've put there for further information. Sorry, if I go back a slide, the link here is to register for support with the national government. So if you are in that extremely clinically vulnerable group, please do register for support. Even if you don't feel like you need it now, it's good to get registered. So if and when you do need help, it will be swifter to activate. And then, yes, this link from Warwickshire County Council, lots of information if you're vulnerable, but also a helpful form that you can search if you feel like you're needing some practical or emotional help, which will show you what local groups are available to you. So you can either access that information through calling the hub or do it online, whatever is your preference. So I then just wanted to obviously kind of remind everybody about those key prevention messages, which haven't changed, around washing your hands regularly. Hot soap and water is the best, but obviously if that's not available, hand sanitizer of alcohol content of at least 60% is good, but make sure you really smother your hands with that and wash your hands for at least 20 seconds. Cover your face, so do wear a face covering if you're out and about, particularly if you're going to be in an enclosed space with people you don't normally meet, and areas where social distancing may be difficult, but really helpful to wear it out and about. We're encouraging people to wear them, for example, at school gates. So even though that's outdoors, parents can kind of congregate and compromise social distancing at times. So just anytime you're concerned, pop your face covering on as an extra level of protection, and obviously keeping that space between yourself and others when you are out and about. So you know the key messages there from the first wave. So now we are in the kind of lockdown restrictions. The message is to stay at home as much as possible in order that we protect the NHS and save lives. And then just a reminder of what to do if you do contract symptoms. So if you think you've got symptoms of coronavirus, please start self-isolating straight away. That would be for 10 days for you and for 14 days for your household if you do then become a test positive. So book a test as soon as you can, either call 119 or visit nhs.uk/coronavirus. If you're negative, your household can stop isolating immediately, and we just say that you can obviously stop isolating once you feel well. So the guidance is that you should not have had a fever for 48 hours. So once your temperature is gone and you're well, you can go out about. Obviously, we want to avoid spreading other conditions as well, such as flu, as we go into the winter period. If you test positive, you should be contacted by the NHS Test and Trace service. So please do share your close contacts with them when you're contacted. So if you are a close contact and you're contacted by test Or if you're identified as a workplace contact and your workplace tells you to self-isolate based on local public health advice, you must self-isolate for the 14-day period from the onset of your symptoms. So when your symptoms start, that's day 0. You isolate for 14 days, and on day 15, you can then return to your normal business, so long as